Hello everyone, I am Dr. Munmun Sahani, consultant neonatologist and pediatrician, Cloud9 Hospital, Sector 14 and 47, Gurgaon. So today we will discuss about a very common topic, that is what are the supplements that my baby needs. So breast milk एक complete nutrition है. It has got the right amount of carbohydrates, fats, proteins, various multivitamins and micronutrients. So a baby on exclusive breastfeed does not need many supplements. Breast milk दो चीज़ों में deficient होता है. Vitamin K, that is why हर एक बच्चे को at birth vitamin K का shot लगता है, and vitamin D that we are now going to see in detail. So vitamin D. Breast milk is again deficient in vitamin D. That is why हर एक बच्चे को vitamin D supplementation की ज़रूरत होती है. So baby who is born at term with a healthy weight requires 400 international units of vitamin D supplementations daily till 1 year of age. एक प्रीटर्म बेबी को या बेबी जिसका थोड़ा सा लो बर्थ वेट है, that baby requires a higher dose of vitamin D supplementation. So a very important question, does a child need vitamin D supplementations beyond infancy? So the answer is that if a child receives adequate sunlight exposure of around 30 to 40 minutes daily, then we do not need any extra vitamin D supplementations. But अगर एक बच्चा indoors ही रहता है, बाहर जाके खेल नहीं रहा है, so we can give vitamin D in a dose of 600 international units daily after 1 year of age. Coming to the second very important supplement, that is iron. So as we know, iron is a very important element which is required for the overall growth and mainly brain development. Iron is required for cognition, learning, intelligence. It also enhances and boosts one's immunity. So iron supplementation is also required by our newborn. A baby which is born preterm with a low birth weight या फिर उसका growth थोड़ा restricted रहा है, so in babies में we can start iron supplementations in the first month of life. So babies who are born at term, are healthy and have a good weight, they usually require iron supplementation between 3.5 to 4 months of age. Now this is the time जब breast milk में iron की जो मात्रा है वो कम हो जाती है, and that is why babies on partial या फिर exclusive breastfeed require iron supplementation. And most of the formulas are iron fortified, so babies on exclusive formula feeds, they do not require any iron supplementation. So iron supplementation in the same dosage is continued till 1 year of age. Next very important question is, does a child need iron beyond infancy? So again, as per WHO recommendations, 3 consecutive months in a year, a child should receive iron supplementation. So even the Indian Academy of Pediatrics recommends iron supplementation in children who are fussy eaters and we have a doubt about their iron intake. Now a very important fact, there are certain precautions that are to be taken while giving iron to a baby. Firstly, parents are always worried about the black stools. So black stools with iron therapy is actually normal and we should not worry about it. Yes, iron therapy leads to a lot of constipation, gastritis, बच्चे बहुत बार vomit कर देते हैं. So for this, it is advisable कि we can either give iron dosage in divided doses. So हम एक ही iron का जितना recommended dose है उसको 2 to 3 doses में divide करके over the day दे सकते हैं, or either we can give it every alternate day. So it's always better to give iron supplementation and just not stop giving iron because of the gastric upset. Thirdly, we are also worried about the black staining of the teeth. So iron drops हमेशा जब भी हम हमारे बेबी को दे रहे हैं, we should give it at the back of the mouth so that teeth का contact ना हो with the iron drop. Also for babies who are more than 6 months old, we can give them a little water to drink after the iron drop so that it cleanses their mouth. Beyond 6 months, we can even give iron along with orange juice or some lemonade or lemon juice so that it helps in iron absorption. One major thing that is to be kept in mind: iron should never be given along with other calcium supplements or with milk, because again, the calcium in the milk or in the supplement will decrease the iron absorption. Now, very important question that usually we come across is whether the child needs routine screening for iron deficiency. So whenever आप अपने बेबी को various vaccination visits पे लेके जाते हो, एक pediatrician will always keep in mind whether the child has any signs of iron deficiency and thus might order some investigations. So the various blood investigations are ordered as per the pediatrician and are not routinely required. Coming to the fourth and the last supplementation, that is calcium. So again, as with multivitamins, calcium supplementation is not required for every baby. Again, this is required in some special conditions, in babies who are born preterm or with low birth weight. Calcium supplementation is again not routinely advised beyond infancy, and it's always better to give our children diet which is rich in calcium and to have a lot of milk and milk products introduced in their diet. And I hope now, after watching this video, you can make an informed decision as to what supplements are really required for your child.